Good day, class. This is our first online lecture on acupuncture. The University of Johannesburg started to offer an acupuncture program through the undergraduates from 2020. This is a 4 year study. Another 2-year postgraduate in acupuncture is offered from 2021. Both of these two programs are designed for the training of acupuncturists. In other words, after studying this program, the successful graduations will be able to be registered with the Allied Health Professional Council of South Africa as an acupuncturist. Therefore, no matter the 4 years or the 2 years study, you will be studying with the full training of acupuncture. The online learning doesn't make the study easier. So you will need to put effort on the study. Also, there's no need to stress. As long as you follow the pace of the program, you will be able to successfully acquire the required knowledge on acupuncture for your future practice. This program, both the undergraduates and the postgraduates, will consist of different topics, including the history, the basic theory, the diagnostics, acupuncture and motion, the therapeutics of acupuncture. And we always start with the history. The history of acupuncture. Why the history of acupuncture is so important. And also, until now, I always talk about the history of acupuncture. However, as you can see from the slides, it writes the history of Chinese medicine and acupuncture. So what's the relationship between the Chinese medicine and acupuncture? Why the history is so important? There might be many confusions on acupuncture. For example, just to name a few, it is from Asia, acupuncture, or even Chinese medicine is from Asia. Does it work on African population? The second question, it is acupuncture and Chinese medicine, it is an old medicine. It's a very traditional medicine. After the study, you will know that the Chinese medicine has been constantly practiced at least for 2,500 years. With the records, without records, it is much longer. And from the proof of acupuncture, we can assume that acupuncture has been practiced for more than 10,000 years. You will know, after studying the history of acupuncture, where I get this statement from. So this is an old medicine, a traditional medicine. Will it conflict to my religion, especially the acupuncture? The Chinese medicine is from Asia. So we got many different religions, especially in South Africa. Someone they may from the background of Christian, someone may have the background of Muslim, some Buddhism, and some other African religions. Will the acupuncture from Asia conflicts to my religion? It is not part of your culture because this knowledge is from Asia. It is not part of your culture, so will you be able to understand and apply the knowledge in Africa? These are some of the common questions. Just to list a few.
In China, a young woman is having open heart surgery. But it's unlike anything you'll see in the West. She's still conscious. Because instead of a general anaesthetic, this 21st century surgical team are using a 2,000-year-old method of controlling pain. Acupuncture. Millions of us now believe that this simple needle has extraordinary powers. Today, more and more of us are putting our faith into alternative medicine.
Ginseng, which is the main herb.
From ancient herbal remedies.
Quite fragrant. No.
It's all way beyond what we normally think of as medicine. To miracle faith healing.
Say it again, healed all!
And acupuncture.
Ow. Oh, moving hurts, doesn't it?
But do these therapies really work? Do they offer something more than conventional medicine? And can science help us find out that these needles really do have healing powers? And in a groundbreaking experiment, I'll discover something truly astonishing about acupuncture. This ancient Chinese treatment is now one of the most popular of all alternative therapies. It's even taking hold within the NHS. Now, nearly 1 million of us use it every year, and it's growing fast. There are clinics all over the place. Now, here in Chinatown, that's not so surprising, but it's happening all over the country. Now, I'm a scientist, and with all that I understand about medicine, it just makes no sense that sticking a needle into a human body could cure illnesses. And yet, millions of people are convinced that...
You may have similar questions as this lady. Few. There might be some other confusions on acupuncture. For example, why is Chinese medicine and acupuncture unique? After the study, you will know that Chinese medicine and acupuncture has been introduced to more than 180 countries globally. What characteristics does the Chinese medicine and acupuncture have in order to be practiced in different countries, under different culture, under different backgrounds? Also, what characteristics of the Chinese medicine and acupuncture have to keep it unique as it is from the original thoughts? Why is it important to learn the history, how to study? So after these few videos, you will be able to answer all these questions. As we've mentioned previously, Chinese medicine and acupuncture is a traditional medicine. And now you are studying under the Department of Complementary Medicine. So what's the difference between these two terms, or what are the definitions of these two terms? According to the World Health Organization, traditional medicine has a long history. It is the sum total of the knowledge, skill, and practices based on the theories, beliefs, and experience of the different culture. It is used to maintain health as well as in prevention, diagnosis, improvement or treatment of physical and mental illness. The complementary medicine, or other words, alternative medicine, refers to a broad set of healthcare practices that are not part of the country's old tradition or conventional medicine and are not fully integrated into the dominant healthcare system. So these are the two different terms. It did also mention that sometimes these two terms are interchangeable in some situations. But from the definition, you will see there are some characteristics of traditional medicine and complementary medicine. The traditional medicine, they are knowledge, skill, practices, the practicals. They're based on the theory, beliefs. Experience is very important. However, beliefs, that's where the arguments come from. That's why in the previous slides, I asked you the question, will the acupuncture, the theory or the beliefs of acupuncture conflict to your religion? Because it is a kind of traditional medicine. Traditional medicine will involve the beliefs. The complementary medicine, the definition is not part of the country. So Chinese medicine and acupuncture, although it is traditional medicine because it has a long history, in South Africa, Chinese medicine and acupuncture is considered as the complementary medicine or alternative medicine according to the definition, because this is not from South Africa, not from African countries, not part of the country's old tradition, not fully integrated into the healthcare system. So here, when we use the definition, we do agree that Chinese medicine and acupuncture is traditional medicine. However, we need to mention that we need to emphasize that there's no beliefs in acupuncture or in Chinese medicine. The argument is from the evidence. After the study, you will know that we don't talk anything related to the beliefs. We don't talk anything related to the religions in acupuncture. So when you take the beliefs away, the knowledge, the skill, practices, theories, experience, that's all the knowledge we need to study from acupuncture. So when there's no beliefs in this content, you'll be safe. There's no conflict to your religion. Another reason why there's no conflict to the religion, we're going to explain later on the topic what aspects we are going to focus on, especially what issues or what matters that the Chinese medicine and acupuncture we focus on. When you understand the focuses of Chinese medicine and acupuncture, you will also understand why there's no conflict to anyone's belief. So here we have two different terms, traditional medicine and complementary medicine. Until now, you might still be confused that whenever I talk about acupuncture, I use the term Chinese medicine and acupuncture, or sometimes I even say Chinese medicine. And in future, when you study the theory, diagnostics, you will see the title of your textbooks, the basic theory of Chinese medicine, the diagnostics of traditional Chinese medicine. Since we are studying acupuncture, we are studying under the acupuncture program. Why we study Chinese medicine? What's the relationship between Chinese medicine and acupuncture? Acupuncture is a submodality in Chinese medicine. Chinese medicine, in a broad sense, it includes the Chinese herbal medicine, acupuncture, masturbation, cupping, scraping, therapeutic massage or trainer, and physical exercise. So there are different modalities within Chinese medicine. And all these modalities, they share the same theory. They share the same diagnostic method. All these different modalities are all different kinds of treatment therapeutic approaches for Chinese medicine. But just in general, in Western countries, in overseas, it is quite accepted that Chinese medicine includes the Chinese herbal medicine and acupuncture. And in this broad sense, the broad definition, a broader definition of acupuncture, this acupuncture includes the acupuncture, masturbation, cupping, scraping, therapeutic massage. That's why in future, when we study the therapeutics, we apart from the acupuncture, from the needling technique, we will study masturbation. We will study the masturbation technique. We will study the cupping technique. That's because these different techniques fall under the category of acupuncture. Also falls under the category of traditional Chinese medicine. This program, the acupuncture content, we started to introduce to our students from 2019 in September and October, November of 2019. At that time, there was still no COVID-19. So when we started to introduce to our students, some students ask, does it work? Does acupuncture really work? Does old medicine, does it work nowadays? Does Chinese medicine still work in modern society? So at that time, I showed them another case, SARS, a severe respiratory acute syndrome, SARS in 2002 to 2003. However, I realized that 2002 and 2003, which were 18 years ago, and consider most of your ages, 2002, 2003 were a bit far for your age. So you were too young to know the pandemic at that time. And now we moved to 2021. Now we are in 2021. And when we study this content, we have the whole year of the COVID-19. This is the data from COVID-19. China was one of the earliest country reports the COVID-19. And as you can see the data from 12th December 2020, China has, all over the world, we have more than 71 million patients, 1.6 million deaths. China has 86,000. South Africa, until 12th December, we have 852,000, almost 853,000 cases. Why are we showing this? When you see China is one of the earliest country reports COVID-19, and when you see the cases, the death, 4,600, there was still a lot, but compared with the 1 million, that's not a lot. China, there's almost 1.5 billion or 1.4 billion population, have 86,000 patients. Have we ever think of the reason? For a country with such a large population, with such a small number of cases, and this was the first country reported COVID-19, and with one of the least mortality rates. What's the reason? What may be the possible reasons? This picture was taken in December 2019. This is my supervisor in China. He is a specialist in Chinese medicine. He was sent to Guangzhou City. There's one hospital, one of the earliest hospitals accepts the COVID patient. This happened before the announcement of the COVID cases. But at that time, the practitioners in China, they found that there might be some human-to-human transmission diseases. That's why they were all dressing like this when seeing patients. In December, and in early January, Wuhan, that's the first city, reports the cluster cases in December. And in January, on the 21st of January, Chinese medicine was implemented, Chinese herbal medicine in the treatment of COVID-19. That's from the state announcement, and also from this hospital, they found that the prescription of pneumonia #1, that's the title of the herbal medicine the herbal medicine formula, is effective in treating mild COVID-19, reduce the occurrence of severe pneumonia. And after the whole year 2019, another formula, 清肺排毒 decoction, was introduced to treat most of the patients in China, especially in Wuhan city. And now we are in 2021. After 1 year after the COVID pandemic, we see from the reports, we're going to share two reports, two systematic review findings. The authors draw the conclusion. In the treatment of COVID-19, traditional Chinese medicine can significantly improve the effective rates, reduce the rate of severe cases, shorten the disappearance of time of fever and cough, so they recover faster hospital stay, and shorten the time to be tested negative. In another paper, the authors have drawn the conclusion Chinese herbal medicine may be beneficial for the treatment of the COVID-19 in improving clinical symptoms, images, lab indicators, shorten the course of diseases, and reducing the number of severe cases. After 1 year, of the pandemic, we can see that the successful of COVID treatment in China, especially with Chinese herbal medicine. The reason why I'm saying so is from another report, you will see that 90%, more than 90% of patients in China have accepted Chinese herbal medicine treatments. More than 90% of the cases, more than 90% of those 86,000 patients were healed by Chinese herbal medicine. This fact has answered your confusion, has answered your question. Does the old medicine work in the modern society. So this is something you are going to learn after the study. You will understand how Chinese medicine treat the COVID-19, how Chinese medicine see the COVID-19 from the theory. How does the Chinese medicine analyze the COVID-19? Obviously, these new diseases, you won't be able to find COVID-19 or coronaviruses in the textbook, or you won't be found in the classics, in our old medical books, because this is a new term. So if you can't find the terms, how can you treat the diseases? So after the study, you will be able to answer this question. Until now, you will be able to answer at least 2 questions. The first one, will the study of acupuncture, the knowledge of acupuncture, be conflict to your religion? The answer is no, it will not. One of the reasons is that there's no spiritual aspects in acupuncture. In future, when we study the basic theory, we will mention this again. We don't focus on spiritual. We don't focus on anything spiritual. The second question, does the old medicine work in modern society? The phenomenal results of the treatment towards the COVID-19 has given you the answer. The old medicine work very well in modern society. And in the next video, in the next few videos, we're going to introduce the value of history. We use one of the example to introduce the value of the history. Why we need to study. I knew it won't affect my religion. I knew it works. Why I need to study why I need to study the history. I can just study the knowledge. I can study how it works and how to do so. But why I need to study the history? We're going to use one example to make more sense to you why the history is so important in the study of acupuncture. And then we're going to introduce some of the accomplishments of Chinese medicine. And this is the thick part of our study of the introduction, the historical development of Chinese medicine. We're going to start from the ancient times until nowadays. These thousands of years, what happens? What are the milestones in Chinese medicine? And eventually, we're going to introduce the modern Chinese medicine. So these are the outline of the history of Chinese medicine. Thank you for your attention.